Okay, so the coronaviruses are a whole group of viruses that can cause anything from a very mild illness, like a cold that we all get all the time, to something like SARS or MERS from the outbreaks over the past years. What's different about this coronavirus is that it's just a novel mutation. They're RNA viruses which mutate very quickly. And it's not surprising that we see lots of new strains emerging, but most of them either won't come into contact with humans or wouldn't be particularly pathogenic to humans. What we see here is one that somehow has got from an animal into humans, and it is causing disease very rapidly within the population. The transmission from person to person is an interesting topic. We don't have data fully to answer that question at the moment. We know that other coronaviruses are mainly spread through large droplet infections, so that means things like sneezing, coughing from an infected person to a susceptible person who hasn't got the disease. So it's very likely that this coronavirus would be behaving in the same way. We've seen that most person-to-person transmission within this outbreak is occurring where there's been very close contact, so healthcare workers or within a family where you would have very close contact, as opposed to people sharing a communal space within a workplace, for example. However, because we don't have the full data at the moment, it's very important that these public health precautions are put into place, such as people self-quarantining and so on. We know that in general, and it's the same for the flu pandemic and other similar outbreaks, it's always the people with pre-existing medical conditions and weaknesses, perhaps the very elderly and perhaps the very young, who are more likely to die from the virus. And it's also more likely that people who are fit and healthy are less likely to have symptoms in the first place if they do become infected. The UK is very well equipped to deal with public health threats like this. So the main points are active surveillance, so screening of people returning from high-risk areas or those who've had contact with people from those areas, and then isolation. So anyone displaying symptoms should first be proactively isolated, and then in that way the virus can really be contained without it spreading too far.